Currently, applied behavior analysis, or ABA, is kind of the gold standard. It's what everyone goes for. It has the most empirical support. Another effective treatment that has emerging support is HFS. HFS is a AI-backed program with a real-life person coaching you through the treatment plan, and it teaches to a child's strengths. And using neuroplasticity, they're able to kind of teach the skills, repair the neural pathways that are damaged, and be able to create new skills and behaviors in the individual. Another treatment that's available for children with autism is mental health therapy, typically a cognitive behavioral therapy approach, or CBT for short. And for younger children, there's also something called AUTplay, which stands for essentially autism play therapy, where they use the principles and theories of play therapy to help kids with autism. So with so many different options out there, I often get asked, like, well, which one's right for my child? And, unfortunately, there's not a real easy way to answer that. However, what you should do is you should talk to the diagnostic practitioner about how autism is affecting your child. Another important factor to consider is time. Each of those treatments have very different time commitments. ABA is typically the most labor intensive because it's usually 10, 15, 20, 25 plus hours a week. And then HFS is 2 to 3 times a week for 60 minutes. So for example, a kiddo that may be very nonverbal and engaging in high levels of self-injurious behavior where they're biting themselves or there's a lot of aggression where they're hitting on other people, that intervention package should be applied behavior analysis. They're gonna need multiple days of therapy and multiple opportunities to practice replacement behaviors, as well as someone highly trained to manage challenging behaviors. And out of the 3 things I mentioned earlier, psychotherapy, which is CBT, and AUTplay, HFS, and ABA, let's say you have an individual that has really great language skills and they have a few friends, but they're struggling to make some new friends. And maybe they have some preferred interests, but they're age appropriate. For example, maybe he's 8 and he likes Legos and video games. So maybe doing something less intense, like just AUTplay therapy or cognitive behavioral therapy to work on some of the deficits present in autism. And then for HFS, you may want some sort of combination of the two. They can have some disruptive or challenging behavior. They can be non-responsive. They can have some verbal protest behavior, but they can't be attacking or aggressing toward other people. They can't be trying to bite themselves over and over again. HFS wouldn't be good for those individuals. Whereas they would need more verbal language to do cognitive behavioral therapy because that's a very verbally based therapy service.